Hello. My name is Gabriel Vaughn. You have asked about healthcare associated infections, so prepare to learn.
What is Healthy People 2020's goal? The goal is to prevent, reduce, and eventually eliminate healthcare-associated infections. To sum up, Healthy People 2020's goal is to establish solutions that all healthcare employees can implement to help reduce healthcare-associated infections. What is Healthy People 2020's objective? Healthy People 2020's objective reflects the commitment of the U.S. Department of Health and Human Services in preventing healthcare-associated infections. With that being said, the objective is stating that the U.S. Department of Health and Healthy People 2020 have partnered up to help achieve the goal of reducing and eventually eliminating healthcare-associated infection. These high-priority objectives address central line-associated bloodstream infections and methicillin-resistant Staphylococcus aureus infections. What are healthcare-associated infections? Healthcare-associated infections are infections that patients acquire while receiving treatment for a medical or surgical condition. Some devices that are employed to help treat patients and help them recover can also cause healthcare-associated infections. For example, catheters, if they are not sterilized properly or left on for a prolonged period of time, it can cause the patient to acquire a healthcare-associated infection. With that being said, healthcare-associated infections are the main cause for morbidity and mortality in the U.S. and are associated with a substantial increase in healthcare costs each year. 1 out of every 25 patients hospitalized in the U.S. are affected by healthcare-associated infections.
Okay, so what are some common healthcare associated infections and why do they happen? Well, let's see. Healthcare associated infections can happen for lots of different reasons. Here are some of the most common healthcare associated infections: urinary tract infection, bloodstream infections, surgical site infections, pneumonia, Clostridium C. difficile, and pressure ulcers are all common HIAs or healthcare associated infections. Now, the bloodstream infection can be caused from a central line associated bloodstream infection or CLABSI. It's a serious infection in which the bacteria or the virus enters into the bloodstream through the central line. Those are very serious. They can become systemic and can cause sepsis. They're very serious. A surgical site infection occurs after surgery and it happens around the surgical site. It can be superficial, right around the skin area, or they can go deeper into the tissue and into the organs or around the implanted material. These are also very serious as they can become systemic also. Now, urinary tract infections happen quite a bit in hospitals and other healthcare facilities. According to the National Healthcare Safety Network, 75% of all these urinary tract infections are caused because of the use of a catheter. So if we could, we might want to avoid using a catheter, or we might want to follow the proper precautions when we're dealing with a catheter. Now, Clostridium C. difficile is also known as C. diff, is when the bacterium causes serious diarrhea in the patient. And we all know what happens when someone has diarrhea. Number one, it's messy. Number two, it can dehydrate the patient and cause an electrolyte imbalance, which is very serious. And the other one, which we're dealing with quite a bit right now, is a ventilator-associated pneumonia. So because of COVID-19, there's a lot of patients on a ventilator, and the infection gets into the lungs through the ventilator. And that can affect not only the lung system, but it can go deeper and affect other areas of the body. But it causes pneumonia, which is very serious, especially with our elderly population. So, and then pressure ulcers. Pressure ulcers happen a lot when the patients are in the hospital for long periods of time. So these are all very serious. So what do? We try to get them out of the hospital as quickly as possible. So what kind of facilities have these infections? Let's talk about that. Well, they can happen in any type of facility, any type of acute care setting or hospital. They can happen in long-term care facilities like nursing homes or assisted living facilities. They happen in outpatient care facilities like doctor's office and dentist's office, dental clinics. They happen in the dialysis facilities for those patients that need dialysis. And they can also happen in ambulatory surgical centers. So once again, hospital-associated infections are very serious and can be avoided if the medical staff just use the proper techniques when caring for these patients.
On any given day, about 1 in 25 hospital patients have an infection caused by their medical care. Almost half of these patients are 65 or older. There are 5 places where patients are most likely to get infections: in the bloodstream, the urinary tract, the gut, and the 2 most common places are the site of surgery and the lungs. The germs most likely to cause healthcare-associated infections include C. difficile, or deadly diarrhea, staph, including the drug-resistant type known as MRSA, a family of germs known as Enterobacteriaceae that includes CRE, the nightmare bacteria, Enterococcus, which can be resistant to an important antibiotic, vancomycin, and Pseudomonas, which can cause infections of the lungs and bloodstream. 1 in every 9 patients who gets an infection will die during their hospitalization. Over the last several years, great progress has been made in preventing some infections. For example, bloodstream infections in patients with central lines have been nearly cut in half in the last 5 years. But more work needs to be done. CDC's goal is to eliminate all healthcare-associated infections. We work 24/7 to save lives and protect people.
On this slide, we're talking about the risk factors of healthcare-associated infections. And as a matter of fact, they're grouped into 3 large categories, which are the medical procedures and the use of medications, which are antibiotics, organizational factors, and patient characteristics. But some of the things that places patients at higher risk for healthcare-associated infections include prolonged hospital stay, which is a very big one actually, because the longer you stay at the hospital, the greater your chances of contacting an infection. So if you think about it, and improper wound care, negligent healthcare workers, uneducated family members, and sometimes their friends. So we really need to pay very good attention to that area. Improper performance of hand hygiene, which is very important also. Lack of proper personal protective wears, and sometimes they're not available enough. And even when they're available, some family members or other people, they do not use them the way they're supposed to be used, which renders them useless. Not following proper sterile techniques, improper use of antibiotics, and individuals who are already immunocompromised. This is a very big one actually, because it just automatically places them at greater risk for contracting an infection.
how to prevent healthcare-associated infections, having all faculty educated and trained on how to perform proper hand hygiene using sterile technique, and the use of proper protective equipment will reduce the chances of negligent nursing practice. Some other ways to prevent healthcare-associated infections is cough etiquette, educating, proper disposal of materials and cleanliness. The financial benefit of using these already known preventative measures actually saves worldwide $25 to $31.5 billion. Interventions. Interventions are closely aligned with preventions when it comes to healthcare associated infections. A lot of the interventions are almost the same as the preventions. It's just how you implement them. For instance, educating all staff members on using proper hand hygiene. As a nurse, you would want to make sure that all the people you work with are using proper hand hygiene. They know proper sterile technique. When using a needle or a scalpel, that they make sure, and you make sure as a nurse, that you're disposing of them properly, as well as dressings, anything with blood or something that looks like it's infected. You would want to make sure you dispose of that in a biohazard container. Teaching the patient's family and friends about proper cough etiquette, donning and doffing PPE, and why it's important that they use PPE is very vital to preventing a healthcare-associated infection. Teaching your patient about good personal hygiene is important as well, making sure they know why they should be washing their hands, why they should be using proper cough etiquette as well. Monitoring the status of wounds, IV sites, maybe there was some sort of pressure ulcer formation before they arrived at the hospital. You want to make sure that you keep a close eye on all of those things, because prolonged hospital stays, as Nellie said before, are big risk factors. You would also, as a nurse, want to make sure that you clean all of your equipment, your stethoscope, blood pressure cuffs, thermometers. You want to make sure that everything is clean and properly cared for.